I'm Shiley and I'm with Pharmacy. Today we have Margot Thompson. She has a chief complaint of increased asthma symptoms. She's a 27-year-old African-American female with a history of mild persistent asthma and generalized motor seizures that are controlled with topiramate. She's complaining of increased asthma symptoms but does not appear in acute distress. She states she has daytime symptoms approximately 3 times per week, uses a rescue inhaler 3 to 4 times a week, but not usually multiple times in a day. And she is awakened by her symptoms approximately once a week. But her symptoms are not tied to exertion alone. She has good compliance to asthma medications and demonstrates proper inhaler usage. For past medical history, she has mild persistent asthma. She's had that for about a year, and she's on maintenance and rescue inhaler. She also has generalized motor seizures, had that for about 2 months, and she's stable on topiramate, so it's controlled. And then there's not any significant family history. For social history, she denies alcohol use. She's a former smoker. She quit about 3 years ago, and she's a full-time graduate law student, so she could be experiencing some stress. She has an allergy to gabapentin, which is the reaction is edema. And her medications that she takes are topiramate 100 milligrams by mouth twice a day, Sprintec 1 tablet by mouth daily, Flovent inhaler 44 micrograms inhaled, 2 puffs inhaled by mouth twice a day. And then she has a Ventolin inhaler 0.09 milligrams, 2 puffs inhaled by mouth every 4 hours as needed for shortness of air. Her immunizations are up to date. She had the flu vaccine January of this year. Her review of symptoms is she's lethargic, not in acute distress. She has increased asthma symptoms, and she has intermittent insomnia. And then for physical findings, she has mild wheezing. For her vital signs, her blood pressure is 110 over 72 millimeters of mercury. Her heart rate is 90 beats per minute. Her temperature is 98.2 degrees Fahrenheit. Her respiratory rate is 18 beats per minute. She's 69 inches tall, or 5 feet 9 inches. She's 158 pounds, and her BMI is 23.3 kilograms per meter squared. For labs, they were all within normal limits except for her red blood cells were a little high. Her creatinine clearance is 120 milliliters per minute, and her serum creatinine is 0.8. She was previously diagnosed with uncomplicated mild persistent asthma. So the problem stated is she has uncontrolled mild persistent asthma, and then the patient's asthma is uncontrolled due to her symptoms of having daytime symptoms approximately 3 times per week, uses her rescue inhaler 3 to 4 times a week, and she awakens at night due to her symptoms once a week. So based on the 2019 GINA guidelines, the patient has 3 out of the 4 symptoms, which qualifies her as having uncontrolled asthma. The patient is also currently taking a low-dose ICS and a SABA, and according to the 2019 GINA guidelines, this would put her at step 2 in treatment strategy. However, since her asthma is still uncontrolled, then it is recommended to move up to step 3 in the treatment strategy, which would consist of a low-dose ICS and a LABA, which is the preferred method, or you can also do a medium dose ICS or a low dose ICS and an LTRA, sorry. And then you would also want to continue the SABA. So for goals, we'd want to control asthma by reducing or preventing the use of rescue inhaler, relieve symptoms of asthma and prevent exacerbations, and maintain normal activity. So my recommendation would be to stop Flovent and put her on an ICS LABA. So Symbicort, 80 micrograms per 4.5 micrograms. I do that by mouth and do 2 puffs twice a day. And I keep her on that indefinitely or until her next follow-up. And then for monitoring, safety would just be oral thrush, so she can rinse her mouth out if she uses with water. And then also headaches and tachycardia. And then for efficacy, want to monitor for improvement of symptoms and needing the rescue inhaler less, and then reassess in 1 to 2 months to determine if a step up in therapy is needed again. Please feel free to contact me with any questions. Thank you.